The path for me to become a doctor really started with the surgery I had when I was 11. So I had an appendectomy. It was, as you can imagine, a very frightful experience. But through that, kind of recognized the power of surgeons. My name is Shang Loh. I'm the Chief of Vascular Surgery at Penn Presbyterian Hospital at Penn Medicine. My role here at Penn Medicine is twofold. One is to perform the clinical duties of a vascular surgeon and to relieve blockages, fix aneurysms where the vessels are dilated, prevent strokes. But also from the leadership side is to develop new programs and initiatives and bring on clinical expertise. So my approach to care is to custom tailor a solution to the patient. What patients may not often realize is there are many different options that I have available, from open surgery to less invasive endovascular solutions. Sometimes I can marry the two for a very durable approach. So for each of the patients, I feel that I have the ability to offer all manners of surgical options and custom tailor that for the most durable approach for the patient. What excites me about vascular surgery and my specific area of interest is aortic work. And while it is not, it is a smaller field altogether, the solutions are very complex because of the large size of the vessel and the many branches. But there's a lot of new technologies that offer us a very minimally invasive approach to treat these disease processes, and this technology really fascinates me. It's also one of my areas of research. The best part of my job, I can describe two scenarios, I think, that really encapsulate that aspect. One is the technical side, is when I fix something like a blood vessel and I restore it in the foot, or the organ at the end pinks up all of a sudden. I think that is a wonderful feeling. It knows that you know that you've done a good technical job and that the patient is really going to appreciate your work. But from the personal side of things, is when the patient who previously, for example, couldn't walk, walks into your office and says, "Doc, my pain is all gone. You know, and I'm exercising again. I can play with my grandkids. I'm super happy." And those are things that you don't forget.